wishing for the object of your metta, that these things happen to them. So you'll repeat this thought. May this person be happy. May this person be free. And may this person be at peace. So what we want to do is cultivate a capacity for kindness. So, close your eyes. Take a few moments to breathe in and breathe out. Chat, let's get started. Welcome to another Healthy Gamer GG stream. My name is Dr. Alok Kanoja. Just a reminder that although I am a doctor, nothing we discuss on stream today is intended to be taken as medical advice. Oh, we can try to turn this up a little bit, I think. Everything we discuss today is intended to be for educational and entertainment purposes only. Maybe I should open a window a bit. If y'all have a medical concern or question, please go see a licensed professional. Hello, everyone. So I have been sick AF, chat. And I don't mean sick AF as in I am like, oh yeah, I'm sick. I mean like I was actually sick, like pretty sick for a while. I'm finally feeling somewhat better. Yeah. So it's been a while. So I was supposed to stream quite a bit last week, but I couldn't talk. Hopefully I can make it through today's stream. But yeah, so like I couldn't speak and was coughing a lot and things like that. And that's the joy of having children in the house, because they are oftentimes, oh wait, this is why. There we go. They are prone to illness. And then I am prone to illness as a result. So sorry about that. We're going to try to make up some of those streams. We'll see what we kind of have time for. But yeah, sorry about that, chat. Couple of things. Let me just get this stuff. Oh no, work. What is wrong with you? Let's reload. There we go. So we're going to do a couple of things real quick before we hop into today's stream. And let me get a couple of things set up. So hopefully y'all have been well. I've missed y'all. Okay, we're getting this set up, And yeah. So a couple of quick announcements before we jump in. And today we're going to be talking about the dark side of meditation. So super, super interesting topic, super important topic, because everyone is like, oh, meditate. Meditation will fix all of your problems. But it turns out that you have to be a little bit careful. And so we're going to review some of the scientific literature on the dangers of meditation, as well as try to understand kind of from a spiritual tradition, because they've been saying that for thousands of years, that meditation is not benign, that you are transforming the energies of transforming your internal energies, which should be done with a lot of care and caution. So we're going to be talking about that today. A couple of quick announcements. The first is that we do have coaching spots open for like the first time in like 2 years over the last like couple months. So if y'all are interested in coaching, definitely check it out. And so we continue to make iterations into the program based on client feedback, and things are generally speaking going pretty well. I know sometimes we'll see a post on the subreddit about people having a negative experience. Happens with some people. But the majority of people tend to really enjoy and appreciate their experience. So if y'all are interested in really focusing on making changes in a set amount of time, I think that's really the big advantage of working with a person. If y'all have more of a mental health concern, so I'd say if y'all have more of a concern that's like clinical in nature, like depression or anxiety, I think working with a therapist or psychiatrist is much more appropriate. But a lot of the things that we see in our community about motivation, life purpose, direction, accountability, responsibility, those are the kinds of things that coaching specializes in. So if y'all are interested, check it out. So one thing I wanted to talk about real quick was we had an autism stream. We had a deep dive into autism, and we got a lot of feedback about it. And so I think some of the terminology and stuff that I used, I think a lot of people in the neurodivergent community were very unhappy with. We've tried to correct that in the description in the video. We're still learning about some of this stuff. And it's kind of like an ongoing process, and we don't get everything right all the time. So we're always grateful for the feedback. For those of y'all that felt alienated or misunderstood, we really apologize for that. It was not my intention at all. We're also working really hard at really making everyone feel safe and included here. So we have actually started the process of collaborating with more people to bring in more diverse perspectives, which I think is really important. So we're working on all that stuff. And so we're always working to bridge the gap between lived experience and sort of like clinical expertise. And I'm maybe somewhere on the ADHD spectrum in terms of neurodivergence, but I think it's really important to try to bridge that gap, and it's something we're very actively working on. I think there was also a really good post about, don't call pot psychosomatic, and that was that really sunk in with me. I totally get where that person is coming from. So we're still continuing to improve the work that we do as best as we can. We're really grateful to y'all for all of the feedback that y'all provide, and we're committed to doing better. Yeah. So today we're going to talk about the dark side of meditation. And I'll give y'all a couple of choices today in terms of how we approach this. So there are a bunch of different talking points that I have, and basically I'm trying to figure out what y'all would prefer in terms of order. So we can kind of do this like one of 2 or 3 different ways. So today we're going to talk about the science of the dangers of meditation. We're going to talk about more like practical, more like lived experience meditation, dangers of meditation. So what do meditators say are the dangers of meditation? What does science say is the dangers of meditation? And then we're going to dig into a couple of things like mechanisms. So this is like super cool, where we now may understand why some of these things happen and like what's going on in the brain. And then we're going to talk about a couple of other like topics. Like when we're talking about the dark side, we can't just restrict things to science. We also have to talk about some of these things like gurus and stuff like that, and abuses of power and how that happens and why that happens. So what do y'all want to start with? Do you guys want to start with, oh yeah, scrap the birthday stream. So, before we get into that, I understand that people made, hold on. Y'all made a bunch of birthday things for me, and I want to express my gratitude. Thank you so much for reminding me. Let's take a look at this chat. So I had a birthday, and I guess there was some community event where people were like uploading stuff. So thank you so much, chat. Okay, start by clicking here and let it play in the background. Okay, cool. So people did portraits. Thank you very much, hon. I have my tea. Can you turn on the air conditioner?
That's so cute. I like the one with you wearing a little blush.
Yeah. Oh, a little blush. Okay. So yeah, thank you guys so much for the birthday messages. Like, I feel, as a spiritual Dark Souls 2 character, let's go. Yeah. Oh my God. This is great. So I got to do this for y'all and give y'all more, I have to upload. I wonder if I have a recording of me playing Dota and flaming my teammates. So when I play Dota, sometimes I flame my teammates. So yeah, thank y'all so much for all the positive wishes. Oh, this is super cool. This is kind of scary, but this is cool. Oh, it looks like there's a video playing here. This is neat. What is this? Birthday? Calligraphy, very cool. And then there's something about, there's a spoiler about Middle Earth. Okay, there's lots of videos. This is intense. What frustrates you so much about Ayurvedic medicine?
It leads to a fundamental misunderstanding of healthcare for a large percentage of patients.
I'm not talking to someone who has an open mind.
Because I think I'm right.
And if I don't try really hard to catch myself, then I will start arguing. This is pretty hype. You guys want to watch this? Let's go.
But at this point, I do feel confident that I can help you some, or at least that's my hope. My hope is that I can take those years of experience helping gamers.
I like connecting with people.
Yeah, right? Doesn't that feel good?
Yeah.
An allopathic physician.
Oh, that's your deal.
I'm an osteopathic physician.
In a world where everyone is looking out for themselves, imagine what it's like if you meet someone who actually cares about other people. Is this weakness? Is what we're doing weakness? You should also accept that, like, you weren't perfect a year ago, or 2 years ago, or 3 years ago, or 4 years ago, or shockingly, you're not perfect now. Feels good to connect.
Yeah. Yeah.
You guys haven't seen the Dota flaming video.
Gamers, and helping parents of gamers, and helping spouses of gamers.
So young, chat.
In my years of training as a psychiatrist, and to be able to put those two together, and to help you in some way. And I really hope that I can.
Have we learned our lesson yet, chat? Is that the quote? Wow, that's a good quote, dude. Can't believe I said it. All right. Okay, I don't think. Okay, we're gonna have to. There's too many of these, so we're gonna have to keep going. Oh God, I don't think. Okay, yeah, I don't know if we have time to watch all this stuff, but this is amazing, y'all. Thank y'all so much. This is such a kind birthday gift. Oh, a cake. All right, chat. GG. Hopefully you guys did. Okay, that's the last one. We're ending on this. Okay, GG. Get wrecked. Get wrecked, Gooner. Oh man. So seriously, this is awesome. Thank you all so much for all the love and positive well wishes. I'm incredibly grateful. It's awesome. You know, people will say things like, I don't understand the impact that I have. And I think, honestly, I probably don't. I don't know if I can. And you know, this is uncomfortable for me, too. So just like we talk a lot about, you know, oh, like, is it uncomfortable for people to give you praise? Like, can you sit with that? It's really hard. That was really hard for me to sit through. Because I really don't understand, I think. Because there was just so much love in what I saw there. And, you know, I sometimes get it when I run into people in the street. And, but yeah, I'm just glad that, you know, what we're doing here has some positive impact. I don't really think about it much. I'm really here for the memes, to be honest. So I think it's important. I don't know. I do this because it's fun. I don't do this to try to, you know, make a difference. Like, I know it sounds kind of weird, but I mean, I guess I kind of do, but it's not, I don't know. Anyway, it's affecting me emotionally, so I'm not able to speak clearly. So thank you guys so much for all the positive well wishes. It's awesome to be supported by all. I can't, there are times where it matters a lot. And so in those times, it's hard for me to describe how important it is to have your support. So it's hard. Maybe one day we'll talk about it, but not today. Enough of the self-serving birthday wishes and focus on me as a human. Some good tea. Honey lemon. Okay, let's get to what we're here for, right? So enough of the circle jerk chat. Let's get started. So today we're going to talk about the dark side of meditation. So I love this topic. So like when I started getting into meditation about 21 years ago, if y'all can believe that, I was super skeptical of it. So I was like a really big skeptic, and I'm still in a sense a skeptic. But I really, so I went to India and I stayed in an ashram, and I was like, what is this BS? And then people were talking about like energies and stuff. And people are talking about manifesting and all this kind of crap. And I was like, what is this stupid BS, dude? What are these people talking about? None of this is scientific. So I practiced meditation for about 3 months and all kinds of different meditations and pranayams. And I really started to like it a lot. I was like, okay, this is actually, there's something here. But I was still somewhat skeptical. So the first thing that I actually did was join a research lab in India while I was still there. So it's cool because the first ashram that I went to had a research division. So I did EEG, studies on EEG on meditators. And so I was trying to figure out, okay, like what does the science say? And for the first kind of year or two, I really focused on practices that had biological plausibility or research support, as well as spiritual stuff. So I gravitated away from the spiritual practices and really focused on, okay, what can science really show is the benefit of meditation? And so that kind of ultimately started a journey where I ended up being a research assistant at this place called the Osher Research Center at Harvard, which is super cool. I was doing somatosensory research on the somatosensory cortex on Tai Chi. So it was very cool. So like learning really about the science of it. And then, you know, when I was practicing meditation, I encountered, and we'll talk about this more towards the end, you know, a lot of weird stuff, including personal experiences, including people that I met with. You know, I had a teacher who was teaching me about Kundalini sadhana. So Kundalini is like this energy that is seated at the base of your spine and rises up through your chakras. And they were telling me that you know, when you do this kind of meditation practice, you can't be near people because you'll become hypersexual. So you and I, that's so fucking shady. You and I need to go out into the woods, into a cabin, and then I'm going to do things to you that make you hypersexual. And then I'll help you control it and clean out your chakras and stuff like that. And it's going to be dangerous for you to be anywhere else. And I was like, okay. And it turned out totally fine. It was great. All that good stuff. But the problem is that when we look at that kind of stuff, right, it's like rife for abuse. And one of the big dark sides of meditation, I know it's sus, is that there is a lot of room for abuse. So we have some of these things. I don't know if y'all have seen like Wild Wild Country. So this is a Netflix documentary about Rajneesh or Osho. And he had like this cult that had this like ranch out somewhere, and they were like poisoning the water supply, and they were like on an FBI like most wanted list or something. And they started like arming themselves and things like that. So we have these kinds of things. There was a temple near me growing up in Texas. So I went to the University of Texas, and there was a temple there, an ashram near there, where one of the gurus got in trouble for, you know, putting his wee-wee where it didn't belong. And there are stories like this all over the place. So one of my favorite institutions is actually a place called Kripalu, which is in Massachusetts. And Kripalu is another one of these awesome ashrams that ended up having a guru who was doing things that gurus shouldn't be doing. So they did something super cool. They kicked out the guru and they kind of secularized the ashram. They kept the deep-rooted spiritual work without the figurehead of a guru. Which is super challenging. So we'll talk about gurus and stuff. So I think that there's a lot about meditation that people don't understand. I think there are dangers to meditation, very real dangers that are scientific. I've worked with people who have had negative psychological experiences from meditation. You know, I've seen patients in the emergency room who are there because they believe they're having a chakra awakening and they're like acutely psychotic. And so, you know, it's super cool to see this stuff clinically. I mean, it sucks for the person, but I'm grateful for the experience in terms of my growth and learning. So there are dangers to it. And I think what's going on with meditation is that, so let's kind of start with like kind of a bit of history, okay? And by the way, this is going to be a little bit more classic Dr. K, where I'm going to just kind of talk at y'all for a little while, okay? So if we want to understand whether meditation is safe or not, we have to understand, first of all, what has happened to meditation over the last 100 years, okay? So between, let's say, 5,000 years ago to about 100 years ago, meditation was basically considered a spiritual tradition that was taught within spiritual settings by spiritual masters. So it's like for the spiritual people, by the spiritual people, spiritual practice. About 100 years ago, some Westerners started to learn meditation. So a big part of this was Maharishi Mahesh Yogi with the explosion of TM, Transcendental Meditation, in the 60s. So Maharishi Mahesh Yogi like shows up, and this is like the good old days of like psychedelics and spiritual gurus and Osho and Maharishi Mahesh Yogi. And so they start teaching meditation. And what happens is a group of people start to really benefit from it. And these people also have a background in science. So they see some beautiful progress with it, and they're like, we should study this. And good job, y'all. So they started doing a lot of studies on meditation, the benefits of meditation. A lot of this stuff was funded kind of by the Transcendental Meditation people. And then over time, we started to explore more and more meditation. And then a couple of like really important milestones. I think a big part of this was also Jon Kabat-Zinn. So maybe about 20 years ago, I'm not sure, and apologies to Jon Kabat-Zinn if I misrepresent this, but so he sort of runs the Center for Mindfulness at the University of Massachusetts. And I think there was a big movement to try to figure out, okay, if we're trying to study meditation, how do we do this? Right? Because if you look at meditation, there's tantric meditation, there's chakra meditation, there's pranayam, there's qigong, there's transcendental meditation, there's mantra meditation, there's visualizations, there's guided meditations, there's yoga nidra, there's deep relaxation techniques. These are all kinds of different stuff. And how do we study this, right? Because these are all different things, like doing like a Wim Hof style Nepalese, I'm going to be in sub-zero temperatures naked and not getting frostbite meditation is very different from do a guided meditation about let's take a walk through your safe space in the forest. These are different things, neurologically, psychologically, consciously, physiologically. These are different things. Right? So there's some techniques of meditation, for example, that can increase the peripheral body temperature by up to 9 degrees Fahrenheit. Okay? About 5 degrees Celsius, 4 or 5 degrees Celsius. That's very different from a guided visualization of walking through the woods. So Jon Kabat-Zinn did something super cool. So he tried to define mindfulness. So what he tried to do, I think, I met the guy many years ago when I was doing research at Harvard because we collaborated some, or he collaborated some with my PIs. But, here's what I see as the brilliance of what he did. He tried to take all of these different spiritual traditions and boil them down to the most basic component, which is what he calls mindfulness. Now, the cool thing about doing that is this standardizes what we're studying. So now we're studying mindfulness, which is these 4 things, like attention in the present, non-judgmental awareness, like a couple of these different things that constitute mindfulness. But this is not meditation. This in Sanskrit is called Sakshi Bhav, which is the very first step of meditation. So a couple of important things happened there. The first is that we're now able to standardize it. We're now able to study it because we're talking about the same thing. So that's good. But we lose a lot of the spiritual power and a lot of the esoteric practices because there's nothing about mantras in mindfulness meditation, right? Mindfulness is not about mantras. There's nothing about energy or shakti or accumulating or manifesting or anything like that. It's just the basics of understanding your mind. And so now what started to happen is we've had a division within this idea of meditation. We have the secularized, sterilized, protocolized, denuded of gurus tradition of mindfulness. This is predominantly what we find in apps. Then on the flip side, we have these more esoteric meditative traditions that do more hardcore meditation. And these things are not all the same. They're apples and oranges. And as we'll discover, there are many different types of meditation which we're now beginning to categorize. So now we get to the issue of safety. Because is mindfulness safe? Is meditation safe? Well, the answer is it depends. What kind of meditation are you doing? What kind of mindfulness are you doing? Because the kind of practice that you do will correlate with how safe or unsafe it is. Okay? So let's take a look at some really interesting articles that are talking about that. Okay. So this, I think, is what we're going to start with. So unwanted effects. Is there a negative side of meditation, a multi-center study? Okay. So what we're going to do, this is a really cool study that looked at a lot of different, this is maybe mean of 87. So this is not a meta-analysis. So the first thing that I want to point out to y'all is that this is starting to happen where people are starting to break apart the different kinds of meditation. So one is something called focused attention. One is open monitoring. One is imagination. One is body awareness. One is compassion. And one is some kind of informal practice, okay? So we talk about this a lot in Dr. K's Guide to Meditation. We talk about dharana, right? Which is very different from just an open monitoring, which is like a mindfulness-based practice. So just to let you all know, this is about, sometimes when I meditate, I'm just sitting there with my eyes closed and I'm just chilling. Right? Just monitoring, just observing whatever comes. This is mindfulness. And there are other times where we're doing practices like charging the laser beam. So I'm putting all of my attention into this point right kind of over here, slightly above the eyebrows and the source of the Brahmanadi. Or I'm doing a focused attention, a practice on something like the Muladhara Chakra. And then I can add something like Mula Bandha, which is a contraction of my perineum, which is also part of a meditative practice. So the perineum is the area between your scrotum and your anus if you're a man. It's somewhere, around the vagina, and it's kind of inside the vagina, kind of near the G-spot for women. So there's a Kegel exercises. When you contract that, that's a different kind of practice. And in the meditative tradition, the benefits of meditation and the risks of meditation correlate with the intensity of the practice. So the hypersexuality inducing practice that I did was a Muladhara Chakra practice. So this is the root chakra. This is where our sexual energy resides. And so as you activate this through meditation, all kinds of things will start to happen. And so even the safety of the practice depends. So doing contraction of the Muladhara Chakra is, generally speaking, pretty safe. Gynecologists will teach this in their office, right, as Kegel exercises. But when we combine that with certain breathing practices, when we combine it with consciousness practices, where we're focusing our attention plus contraction plus pranayam, when we're lowering our respiratory rate or we're hyperventilating, we're doing all kinds of different things that will vastly alter the benefits of the practice, the awakening of the chakra, as well as the safety concerns. So the first thing that we have to understand about meditation is that it's not all the same, okay? So here are a couple of, this is just one categorization. There are other ways to kind of categorize it. Oh, what is this? What did I just do? Okay, there we go. And then we'll look at a little bit more, because this will actually change. Hold on a second, I screwed something up. Okay. So here are the different kinds of things, okay? And then they'll also look at things like years of practice, right? So there are other issues like, how veteran of a meditator are you? Is hiking dangerous or is it safe? Well, it depends on where you go, how competent you are, what your experience is, how prepared you are. That determines whether an activity is safe or not. So now what we can do is they looked at unwanted effects. So this is a sample size pretty small. It's 87 people. So 25%, 1/4 of people reported some kind of thing that they didn't enjoy. The majority of people who had an unwanted effect are, not majority, the plurality of people are individual practice. And this is what's really interesting, is that focused attention actually has the highest likelihood. So 17% of people who had an unpleasant experience were doing focused attention. And 8% of people were doing body scan. So body scan seems to be the safest. Focused attention is the most dangerous, and we'll talk about why that is once we get to the meditative theory, because yogis will tell you the same thing. The other thing that we tend to see is that a higher duration of practice correlates with more adverse effects. And I don't know if y'all have heard me talk about this, but usually what I'll say is that we should meditate for about 20 minutes, right? So I've said this. So if y'all watch Dr. K's Guide to Meditation, about 18 minutes is how long it takes to trigger inhibition of cortisol production from the hypothalamus. So meditating under 20 minutes is basically quite safe. And the longer that you meditate, greater than 40 minutes, we see an increase in the risk of side effects. Let's look at the kinds of side effects people get. So people will get anxiety, including panic attacks. So I think some of this is like physiologic in nature. Depersonalization or derealization experiences are also quite common, right? So 10% of people have some sense of disconnection or disconnection from the self. And then, but half of the people don't report any kind of details about what is unpleasant. The good news is that very few continuous symptoms are quite rare, right? So when we advise people about meditation, we say, if something weird is happening, stop, first of all, and then go see a doctor. Those are the two things that you should do if you have an adverse experience in meditation. And people may wonder, okay, what is a doctor going to do if they don't understand the meditation? You'd be surprised at how decent they are, right? So we're trained in a lot of like basically simple clinical reasoning, which is like, if you're doing something and it's hurting you, stop doing it. And let's evaluate you for other things that could be going wrong, right? Let's just do a thorough diagnostic workup for psychosis, for panic attacks. Let's just see what's kind of going on here. So we have systems, even if a doctor may not be sufficiently trained in meditation, we are generally trained in the things that are dangerous, right? So we know how to detect schizophrenia. We know how to detect mania. And we're good at picking up that stuff, so we can just make sure that something else isn't going on and that you can be safe. Good news is that the majority of people don't have continuous problems from meditation. It looks like discontinued meditation, yes. That's kind of scary, right? Very few people discontinued. And very few people sought care from a medical professional, which I think makes a lot of sense, which is why we try to encourage you to do that, right? So don't be like these people. So once again, we're starting to see some basic issues about, or basic understanding of side effects from meditation. And then we're going to go on even a little bit more. So now the paper, what it really does is looks into a lot of different specifics of what kind of adverse effect people have, right? And we see some of this stuff in our community. So 66% of people experience some degree of lack of interest in their surroundings. This is arguably a benefit of meditation, right? That we become a little bit more detached. Lack of interest in other people's conversations. IDGAF, chat. I'm just not interested in other people. We start to feel bored by other people, right? This is a percentage of people who have some kind of minimum scoring of yes. And the good news is that this is the percentage of people who experience maximal symptoms of this. And this is very low, right? So it's not like people have a 10 out of 10 great emotional pain, but 52% of people experience some degree of emotional pain. 45% of people experience some degree of self-criticism. 59% of people experience some degree of more fear, anxiety, or depression. 68% of people experience a lack of orientation, less motivation in life, right? And so now the question becomes, is this an unwanted side effect, or is this part of the benefit of meditation? So these are kind of reported negatively, but I think this is important for y'all to understand, is that there could be changes if y'all meditate in all of these different dimensions. And this is why it's important when you learn meditation to learn from someone who is like a competent practitioner or a medical professional, because they can help you navigate through these things, which we'll talk about in a little bit. Okay, so now what we're going to do is take a look at a couple of the conclusions of this study. Okay. So first thing is, most reported unwanted effects are mild and do not lead to discontinued meditation or the need for medical assistance. So that's pretty good, right? So even if something happens, I think y'all should stop, but they don't lead to long-term consequences. Okay? So in fact, what does E use? Can be related to changes in detached perspective of the self, different stages of insight, or the use of meditation in participants with previous pathological disorders that have not been correctly diagnosed, okay? So what this kind of is talking about is that some of these can be psychologically challenging. They can lead to a detached perspective of self. They can lead to changes in the way that you see the world, okay? So study also confirmed the second hypothesis, that a higher frequency of practice may generate more unwanted effects, especially in terms of duration of the session. So the more you meditate, the longer you meditate, the more hardcore you meditate, the greater the chances are of some kind of side effect. This is why we, generally speaking, advocate for 20 minutes a day, 3 to 5 times a week, or even every day is okay. So this is also really important. Confirmed our initial hypothesis that some types of meditation practices may interact to influence the prevalence of unwanted effects. Focused attention is associated with unwanted effects, i.e. the most dangerous, whereas body awareness practices are associated with fewer unwanted effects. So let's talk about this for a second. Why is this? So if we look at the clinical use of meditation, when we use meditation in a clinical setting, not all meditations are the same. So if you look at something like dialectical behavioral therapy, Dialectical behavioral therapy is a therapy that has a lot of grounding techniques. So these are people, this is usually used for people who have things like borderline personality disorder. So intense amounts of emotional dysregulation when things are bad. People with BPD can also have a tendency to experience derealization or depersonalization. They feel untethered from their sense of self. They can have a lot of negative thoughts. So we want to use meditations that ground them in their experience of self. So when someone is having a borderline personality disorder crisis, they're catastrophizing. They think they're a terrible person. They're also activating some hemispheric lateralization, which means that their brain is actually activating a dissociative protective mechanism. Okay, this is all in Dr. K's Guide to Trauma if y'all are interested. So what happens when we experience too much is our brain, just like tech support, is like, you know what? This is busted. Why don't we try turning it off and turning it on again? So if you have some problem in your computer, what do? You turn it off and you turn it on again. You'll see if that fixes the problem. Works in the brain too. The brain is a computer. So the brain is like, you know what I'm going to do? I'm going to dissociate for a little bit. I'm going to let this physiology calm down, and then I'll plug back in tomorrow. This is what a dissociative episode is. Gets triggered by trauma. We even know that the neuroscience of this is we have our right hemisphere, which experiences a lot of emotion. We have our left hemisphere, which experiences a lot of analysis. And literally what happens is the traffic between the two hemispheres starts to get reduced. Traffic across the corpus callosum gets reduced. Bessel van der Kolk did some amazing studies on this. And when that traffic gets reduced, we basically block off our emotions. We don't experience them anymore. When we dissociate and we become depersonalized, our analytical mind is working, but our emotions aren't active at all. So when people talk about trauma, right, they can talk about it in a very, very numb way because they're just thinking about it very dispassionately because the emotions are too much to handle. The brain is trying to protect you from it. So the body will release natural endorphins to protect you from the sensation of pain, right? That's why pain gets better over time. When I have an acute injury, it hurts a lot. And then over time, it starts to hurt less. That's because endorphins are kicking in. Our psychology, our neurology has the same kind of protective mechanisms. So body awareness practices makes perfect sense that they do not lead to negative experiences because these are the practices that we use to ground people in their body. Now, focused attention is a different category, and open awareness is also a different category. So one of the things that we have to be careful about for open awareness meditations is this is when I'm just sitting there and I'm going to observe non-judgmentally whatever comes up in my mind. Now, this works great if there isn't a lot of toxic stuff lying dormant in your mind. So remember that our mind has psychological defense mechanisms. What is that? So our mind, in order to stay safe, blocks off certain negative experiences. So y'all will know this if you've ever talked to someone who's in denial, right? You try to tell him, hey, your drinking is a problem, bro. And he's like, no, it isn't. It's fine. I'm not as bad as this person. It'll be a problem when I'm as bad as this person. That's when it's a problem. It's not a problem right now. It's not my problem. You can have a narcissistic defense, which is like, you know, I'm great and you're wrong, you're bad. It's a very black and white way of thinking. You're doing everything bad. I'm doing everything right. Right? Because why? Why does the narcissistic defense exist? It exists because if you screwed up and you acknowledge how bad you screwed up, the guilt from that could be so overwhelming that it would cripple you. Right? So this is why we have defense mechanisms. And defense mechanisms are there for a reason, to protect ourselves. So when we do some open awareness meditations, we have to be very careful if you have a history of trauma or something like that. Because as we non-judgmentally observe things. The problem is that the non-judgmentalness is a skill. If you just stop for a second and close your eyes and you observe whatever comes up, the basic problem of being human is that we are not non-judgmental. As a thought comes up, I'm a loser, we can't view that thought non-judgmentally. As a thought comes up, oh, my friends from high school are doing so much better than I am, we can't view that non-judgmentally. We may be able to view some negative aspects of ourselves non-judgmentally, but there's basically a difficulty curve, right? It's like there's a level 1 mob, there's a level 99 mob. And these things have very different hit point pools, very different damage, very different armor ratings, very different move sets. And so the thoughts in our mind have different levels of difficulty, different strengths for us to be detached from. So open awareness meditation, I do not recommend if you're keeping a lot of stuff bottled up. So if you engage in a lot of avoidance strategies, video games, pornography, drugs, whatever, oh, I'm feeling bad, let me go distract myself from my mind. What is that? That's another defense mechanism. So open awareness is the process of opening that up, letting whatever comes up. It can be useful. It can be good, right? Because we want to level that up eventually, but it can be very dangerous. So I think open awareness meditation, for example, I'll do that with patients with a history of trauma if I'm there with them, because then whatever comes up, then we work through that, right? So you have to be careful about open awareness. Now we get to focused attention. Now, why is focused attention the most dangerous? Because focused attention is the stuff that is activating all the chakras. Okay, so now we have to understand this very clearly. See, all the weird esoteric techniques are not body scans. They're not open awareness. They're focusing your energy into a particular chakra. So the ones that are more powerful, the ones that are more dangerous, are the ones that involve focused attention, because it is a meditative goal that you are trying to achieve. So there are easier versions of this and harder versions of this, or more powerful and less powerful. Let's put it that way. So, right? So when I'm defining power as there's more powerful explosions and less powerful explosions. That's neither good nor bad. It's just, if we're talking about fireworks, great, we want a less powerful explosion that does the job. If we're talking about nuclear fusion, cold fusion, nuclear fission, right? We can't do fusion yet. That's a whole different ballgame. So with the more powerful meditation comes more danger, just like the difference between a firecracker and a nuclear reaction. And all of the techniques that are more esoteric in nature usually involve focused awareness. So that makes them both more potent and more dangerous, okay? Let's look at focused awareness was found to be positively, hold on, what is Zoom? So focused awareness was found to be positively associated with greater self-criticism and feeling that the time spent not meditating was wasted. We're going to talk about that in a second. What else did I want to say? I think that's it from this one. Okay. So this paper, let's just kind of recap, right? So this paper is looking at the different kinds of meditation and recognize the different kinds of side effects that we can have. And we have a couple of quick TLDRs about safe meditation practice. First of all, if something bad happens, stop. If something bad happens, go seek guidance from a medical professional or a spiritual teacher who's competent. Next thing is frequency and duration of practice increase the risk. And focused attention is more dangerous and also more potent. Body scanning yourself for 20 minutes a day seems incredibly safe, according to this paper, right? And also as a clinician, I've seen very, very, very few adverse reactions to body scanning. None comes to mind. I'm not saying that they can't happen, but I've never really seen one. The only thing I can think about and we'll talk about this in a second too, is that sometimes if people are already not in a healthy state of mind, then body scanning can be problematic. So if I'm working with a patient, for example, with the Cotard delusion, So this is a manifestation oftentimes of schizophrenia. The Cotard delusion is the belief that a part of your body is dead or rotting. So people just believe, they're like, my kidney is dead. And you'll be like, what does that mean? And they'll say, like, my kidney is dead. Like, it's rotting inside me. It's no longer alive. A part of my body has died and is rotting, and it needs to be removed. And we check their GFR, glomerular filtration rate, seems completely normal. Their creatinine clearance is normal. Kidney looks intact. We can ultrasound that baby. Looks like it's working fine. So sometimes what happens in schizophrenia is we have all of these benign symptoms from our body, signals from our body, which that get interpreted through the schizophrenic mind as negative, right? And let's just talk about that for a second because it's cool. So the problem with schizophrenia is that there are associations that get made that normally shouldn't get made. So if I look up at the sky and I see a cloud and I say, that looks like a dog. It's not a dog, it's a cloud. It's a random assortment of water molecules that have been vaporized and are in the atmosphere. There's no dog there. But our brain has a circuit that generates a pattern out of neutral stimuli. In schizophrenia, this circuit becomes hyperactive. So when I'm walking down the street and I see someone walking by me and they nod, I'm like, that means something. We start seeing patterns where they don't exist. Then I walk past the second person, this person smiles. And I walk past a third person, and this person is on their cell phone. And I think to myself, hold on a second, this is 1, 2, 3. And then I look at the door, the address of the place next to me, and it says 111 123. There are 3 ones, and it's a 1, 2, 3. And then I see a car that has 0, 2, 3. Because there are too many ones over there, and there's 0, 2, 3. There's an absence of ones, so this is somehow connected. There's 1, 2, 3. I'm seeing 1, 2, 3 everywhere. And this is what happens in schizophrenia. So now what we think about is that sometimes with body signals, this can happen. So when I work with people who have things like the Cotard delusion, I'll ask them, tell me what the sensory stimuli are. And usually what happens is they have an olfactory stimulus. Something is smelly. Something smells like it's rotting. I smell something rotting. And then everywhere I go, I smell the rotting smell. Therefore, what do you conclude? It must be some part of me. And by the way, I feel a twinge over here. Maybe you've got a tiny little kidney stone forming, right? Or you sleep on one side or something like that. And then they combine these things. So body scans, we have to be careful if someone has some pre-existing thing. So if they have an internal hypersensitivity, which we can see in things like panic attacks, we can see in things like irritable bowel syndrome, then we have to be careful about body scanning. Okay? But generally speaking, focused attention is more esoteric, more powerful, therefore more dangerous. Now let's take a look at a couple of other things. Okay? So meditation-induced psychosis, a narrative review, and individual patient analysis. Beautiful, beautiful paper. Let's go straight to the discussion. So the first thing that the paper talks about is meditation works on a neurochemical level and seems to mimic the effects of things like psychedelics. And we'll talk about that in a second too. Actually, let's just talk about it now. So what's the deal with meditation and psychedelics? So oftentimes I'll get asked this question. Hey, I use my psychedelics. Is that the same as meditation? So the answer is yes and no. So there are a lot of studies that show that meditation activates certain neurotransmitters, like the release of things like serotonin. This paper talks about DMT and how DMT. There's some overlap between how psychedelics work in the brain and how meditation works in the brain. We also sort of know that from a subjective experience standpoint, right? Because people who meditate deeply will start to trip, and you can trip with psychedelics. So there's some overlap there, but I don't think that one is a substitute for the other. Now let's understand why. Thankfully, now we have a good answer to this. So if you look at studies on psychedelics for therapeutic value, now everyone's saying, oh, psychedelic can be used to heal, right? They can treat PTSD. They can treat depression. Ketamine in the US can be used to treat acute depressive episodes. Psilocybin can be transformative. We have to be super careful, though, because psychedelics, just like meditation, can lead to mental illness. They can induce psychosis. They can induce panic attacks. I've worked with patients who have PTSD from trips. Their trip was so bad that their physiology wires into a hyperactive state, and they're left with PTSD and bad PTSD, crippling PTSD. The most common things that I see from bad trips are something like a trauma spectrum disorder, something like an anxiety disorder, and something like a panic disorder. Very rarely do I see things that are like negative mood and stuff like that. Maybe sometimes. But here's what we know. So if it can be healing, how can it be healing? How can it be harming? What's the difference? So if you look at the healing, the situations in which psychedelics are healing, they're always done with guardrails. So what psychedelics probably do from a neuroscientific mechanism is they induce neuroplasticity. So they create alterations in the brain. They put your brain out of read-only mode. Now we're in editing mode. And this is what's so interesting. It is the integration of the psychedelic experience through psychotherapy afterward, or when you work with a shaman or someone else who's like familiar with this stuff, they integrate the experience for you. So if we look at the trials, we see things like, 14-week trial with 14 weeks of psychotherapy with 2 or 3 doses of psychedelics sprinkled in the middle. So let's talk about who you are. Let's understand what your issues are. Now we're going to use a psychedelic. Now we're going to, see how things go. The environment is very controlled. Many of these studies oftentimes have a male-female dyad of therapists who will sit with you for 8 hours and guide you and keep you safe through the experience. Afterward, now your brain is in edit mode. And then when you do psychotherapy after that, you are shaping things in a very healthy and safe way. So the trip itself doesn't transform you. And both the spiritual traditions and the psychotherapy tradition have found that healing through psychedelics requires not just the activation of the neuroplasticity, we're putting it into edit mode, but then what happens afterward? What are we actually writing in once it's in edit mode? And what we see from negative experiences of psychedelics is people will trip and they have no guardrails. So what gets put in there, who the fuck knows? Okay? And it turns out that meditation is the same. So when you have adverse experiences, or similar, I should say, in meditation, the guidance of a guru becomes very important because they can help you work through those negative experiences and get you to the other side. Meditation also induces neuroplasticity. The good news is that meditation, the process of meditation, also trains you mentally, right? So you practice this for days and days and days and days and days, weeks and weeks and weeks and weeks and weeks, until you have a psychedelic experience through meditation or spiritual experience, right? But during that time, what is happening? The neuroscience of meditation shows us that your frontal lobes are strengthening, very important. They're the parts that can put brakes on other parts of our brain. Our emotional regulation skills are improving. We're getting increased connections to things like the amygdala. We also are increasing our capacity for attentional control. That's literally what meditation is doing. I'm sitting down, I'm focusing on this. My mind wants to wander over there. No, I'm going to focus on this. Now, when you're having a bad trip and you have no attentional control and some demon is sitting in front of you, and you cannot control your mind to return to the breath and ignore the demon, then you're going to get caught up in the demon. The demon's going, ah, rah, 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 rah. And then you get caught up in it and it traumatizes you. So meditation in this way trains your brain in a way that psychedelics doesn't, right? Because it's an artificial substance that is just board the roller coaster and it goes where the fuck it goes. But we also see a very similar kind of takeaway, which we'll show you all in a second. So basically, intense meditation, even though meditation can be used for healing and has positive clinical effects, it should never be used acutely to treat an acute thing, just like psychedelics. So for psychedelics, if you're in the middle of a depressive episode, you should not use psychedelics. If you're manic, you should not use psychedelics. And I've had patients like this who've been acutely in a mixed state, really bad mixed state, bipolar disorder, who are like, I want to go to a 10-day silent meditation retreat and fix this. I'm like, no, bro. You need to be in a hospital, not a 10-day I'll help you get to the 10-day meditation retreat, but a lot of these meditative experiences are very stressful. They're very difficult, and you need to be stable and healthy. Another just really interesting tidbit, which I love. So some of these studies on psychedelics, psychedelic-assisted psychotherapy, fascinating, will also have something called a washout period. So before we start the psychedelics, we're going to detox you off of your psychiatric medications for 2 weeks in a safe setting, sometimes including a hospital. Because psychedelics work on these neurotransmitters, meditation works on these neurotransmitters. And so there are certain safeguards around some of these clinical trials, which people don't think about when they think about using psychedelics for healing. Completely different situation. Do you all understand the significance of a medical washout period before you do a clinical trial? No one does that shit at home. And furthermore, it's not even safe to do that at home. If you're on a benzodiazepine and you just go cold turkey, you can have a seizure and die. So they do this stuff in medically controlled settings. Okay? So for going back to meditation, though, we know that there are a lot of these neurotransmitters involved. It's probably somewhat similar to psychedelics. We're not going to go too much into these, but okay. So we also know, so it has been suggested that meditation should be contraindicated in people suffering from psychiatric illnesses such as psychosis. However, looking at the evidence, one could find that meditation combined with yoga has been shown to have positive effects on negative symptoms in schizophrenia. Right? But this is also important because it's not all the same. So yoga is a very good practice for schizophrenia, but that's not the same as meditation. So meta-analysis showed that mindfulness-based practices to be moderately beneficial in treating negative symptoms and could be used as an adjunct for pharmacotherapy. This is a quick aside, by the way. I know this is about side effects of dangers of meditation, but so this is super cool. So schizophrenia has, I guess we're talking about schizophrenia. Classic Dr. K. So schizophrenia has two kinds of symptoms, positive symptoms and negative symptoms. So positive symptoms are usually what people know about schizophrenia: hallucinations, delusions, paranoia. But the more crippling stuff in schizophrenia is actually the negative symptoms. These are things like amotivation, anhedonia. The cool thing is that we don't have great medications. Arguably, some third-generation antipsychotics are pretty helpful at negative symptoms, but most of our medications for schizophrenia are very good at treating positive symptoms, not the best at treating negative symptoms. But meditation can help with that. And so the really interesting thing for those of y'all that are struggling with, I'm not motivated, things are not fun for me, right? I just don't enjoy my life. I'm kind of like, I have low energy. If you're kind of one of these people that like life just has no zest and you don't really feel like doing anything, meditation has been shown in studies to help with that in schizophrenia. It invigorates your love and passion for life when done in the right way. Okay? And thank y'all in chat for defining things that I'm not defining for people who are newer. Okay. So this is different from the meditation practiced by most of the cases where patients would get engrossed in chanting mantras and trying to get into altered states of mind, indicating that transcendental meditation could be more psychosis prone with mindfulness-based practice. So now we're seeing once again in the literature this idea that not all meditation is the same. There's a clear need to delineate between traditional meditation practice and therapist-guided meditation practice interventions practiced in a clinical setting in order to explore their role of the trajectories of outcome from a patient suffering from psychosis. Well said, right? So what that means is like these are not all the same, and we need to start being sophisticated with our language. So now now this is cool. Most of the patients described in this review who experienced psychotic episode precipitated by meditation attended intensive meditation retreats rather than practicing brief mindfulness interventions. Some of these patients were higher risk because they had a history of psychiatric illness. Adverse effects, this is also really important. Adverse effects of meditation are confounded by factors such as sensory deprivation, loss of sleep, fasting, all of which may serve as precipitants for a psychotic episode. Various other factors include history of substance abuse, traumatic life events in the past, right? We've talked about that. Let me find, there's one other. Yeah, so I think that's the main thing that I wanted to take away from this paper. So what does this paper tell us? Intense meditation is dangerous. Fasting for long periods of time is dangerous. Meditation, and I've done this stuff, okay? So like I've done very extended fasts, gone 24 hours, meditating, things like this. And those things are very hardcore. Like these 10-day silent Vipassana retreats are very difficult. They require a lot of resilience to get through. So it's kind of like this more hardcore meditation. We're getting further away from the firework and closer to the nuclear bomb. And the data suggests that the more hardcore you are about meditation, the more dangerous it is. And that some of these things like mantra meditation, this Shakti activating stuff, can be more dangerous. Okay? Let me see. So this is a case report, okay? So I'll just show you, we'll just kind of just show you all. So meditation-induced psychosis, trigger and recurrence. We're just going to jump to 1 or 2 sentences here. The patient was maintaining well without medication for about 9 years after a first episode of acute psychosis, and then a second psychotic episode recurred on the 16th day of practicing similar intensive meditation. Okay? So there's also evidence suggesting that meditation alone is not the only causal factor for psychosis, but other factors like sleep and sensory deprivation and fasting during meditation may precipitate psychotic episodes. In our case, various components of meditation like sleep deprivation, fasting, social isolation, long hours of meditation, past history of psychotic experiences have been contributing factors. As underlined by the review about Qigong-induced mental disorders, a psychotic deterioration is the result of meditation that acts as a stressor in vulnerable individuals. So much like psychedelics, we don't want to do this stuff if we are not in a good headspace. Okay. When meditation is practiced under proper guidance and in moderation, meditation can enhance psychological well-being. Even individuals with psychosis can benefit if the practice of meditation is tailored accordingly. Okay? So this is kind of our literature review. So what's the big TLDR at this point? TLDR is the more hardcore you meditate, the greater the risk is. So now we're going to talk a little bit about why do people do this kind of stuff. So this is where things get wild. And then we'll talk about gurus because there's other parts of meditation. So I want y'all to understand, like, why do we do all this weird stuff when we meditate? So I want y'all, we got to go back a couple thousand years, right? There was a guy, probably today known as Shiva, in the Hindu tradition. But I think if we look at it from a more anthropological perspective, if we look at it, right, this meditation practice started somewhere. So one human being had to be the beginning of it, right? Someone had to figure something out and say like, hey, like, look, I'm meditating. Like, this is cool. And I think what happened with Shiva is he sat down, presumably it's a he, but could be Shakti or Parvati. Who knows? Maybe it was actually 2 people. Sat down and started to try to understand, like, what is the nature of what is going on inside me. And they made a very fundamental discovery that there is a layer of something beyond mental activity. So most of the time when we're living our life, we are living within mental activity. I have this thought, I have this emotion. I have this perception. These are all products of the mind, and we think this is what reality is. But if we look at the most fundamental level of your reality, it isn't thoughts or emotions. It is actually that you are always the one who experiences your thoughts or emotions. You can't experience anyone else's emotions, and no one else can experience your emotions. You are the one who's always living your life. Your thoughts change, your emotions change, your mind changes, your body changes, your identity changes. Everything changes in your life, except for one thing, which is that you are always the one living it. So then I believe what Shiva did is tried to get to that. So realized, okay, this is not real. This is not permanent. This is not permanent. This is not permanent. Let me get to the source. So they figured out some kind of technique to stop the activity of the mind. And in doing so, they opened a door. People think that this is the goal of meditation, is to stop the mind. No, that's the beginning. That's opening the door. It's not even walking through. So we have pratyahara, which is sensory withdrawal. This is the practice of pulling my mind away from where it wants to go. So the first step is my mind is scattered all over the place. First thing I got to do is restrain it. Because if I don't restrain it, then it'll think about this, and 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 I'll never go beyond mind. Second thing is focus. So when we're going to pull away, and then we're going to concentrate on one point. Most of the time, the energy of our mind is like a light bulb. It exudes light in 1,000 different directions. That same energy can accomplish very different things if it's concentrated into a laser beam. This is the practice of dharana, focused attention. That's step 2. I'm going to focus my mind on one thing. The breath, charging the laser beam, the third eye, chakra, whatever, mantra, whatever. Fundamentally, there's focused attention. Then we get to Sakshi Bhav in the no-mind state, dhyan. This is step 3. This is where we have melded our mind with the object of meditation, and we move beyond the self. And then beyond that is samadhi. These are higher states of consciousness and meditation. That's when you start walking through the door. Now, here's what they figured out. So if you all have meditated, you know this. Where every time when you sit down to meditate, you may not be able to achieve the same state of mind. Some days your mind is more distracted. Some days it's less distracted. Some days you achieve a quiet mind, and then some days you feel something intense. Some days it just feels different. Your consciousness is in a different state of mind. The problem is that is inconsistent. You can't do something to create that state of mind. Right? Because you can't just perform the same action, because it's not about action. There's physical action, then there's mental action. I'm trying to tell my mind to concentrate, but once the mind shuts off, I can't tell it to do anything. Does that make sense? Telling and forcing is a mental activity. So how do I get it to move if I can't tell it to do anything? Where even a desire will shatter the state. Okay? This is where the fasting and sleep deprivation and intensity of practice come in. So it's my scientific or medical belief that these more advanced systems of meditation are working on a very physiologic level. There's one technique, for example. You guys know what the average respiratory rate is? I'll drink some tea while we're... You guys know how many breaths per minute most human beings do? I see someone saying 14. It's about right. 12 to 15, 16, yeah. Right, so we'll breathe every 4 to 6 seconds on average. So there are some techniques of meditation where you breathe once every 6 minutes. And there are some techniques of meditation where you breathe about 240 times a minute. Think about it, 240 breaths per minute. Both of these seem physiologically impossible. Now we have some, free diving has become a thing, so I think people have figured out low respiratory rates. But the main thing that we have to think about at 1 in 6, how do you not die? you train yourself. Same way that free divers can breathe once every 20 minutes, right, when they're swimming. So let's understand, how do you not die? That is the operative question. So what are the physiologic changes that happen when you alter your respiratory rate? So the main thing that we're worried about is oxygen, carbon dioxide. It's really the carbon dioxide that is the bigger problem than the lack of oxygen. So what happens is our body has a balance between, our body basically maintains its pH in one of two ways. We can breathe off carbon dioxide, which is bicarb, okay? We can breathe it out, or we have metabolic contributions. So when I start breathing very slowly, there are other systems of my body that will compensate. So when I have a very low respiratory rate, the pH in my body goes down. As the pH goes down, certain things like my kidneys and other parts of my body will start to create a metabolic balancing effect. And when you practice meditation for a very long period of time, these compensatory mechanisms kick in and they develop. It's kind of like, in the same way that a liver of someone who drinks every day can handle lethal amounts of alcohol because the compensatory enzymes are ramped way the fuck up. So when you do slow respirations for an extended period of time, years, your compensatory enzymes ramp up quite a bit. The same is true for the hyperrespiration. It's just in the opposite direction. And probably what we know is that when we alter, this is where things get wild, okay? So this isn't like super scientific. It's all extrapolated from science. There's one other really interesting data point, which is people who are dying. So if you talk to people who are dying or died, they have some very interesting subjective, spiritual, or psychedelic experiences. Now, let's understand what is going on in the brain when someone is dying. The most fundamental thing that is changing relates to the breath. There are changes to CO2 concentration and O2 concentration. That's what death is. The basic source of metabolism, the basic source of life is oxygen. So when we safely and under the guidance of proper gurus, right, because this stuff can be lethal if it's not done in the right way, when we train our physiology, we need a very fine-tuned physiology. So I'll give you all an example. This practice with the 240 respirations per minute cannot be done if you have caffeine in your body. Can't get it. It's very fascinating, but you just can't do it because the caffeine alters the way that you breathe. Impossible. So this is why esoteric meditation is oftentimes done with these things, because remember what they're shooting for is a state of consciousness. And attaining that state of consciousness through intense fasting, right? What do you think a prolonged fast is going to do to the brain? Probably do something very similar to dying metabolically on some level. Very particular activity of neurologically active substances, so no caffeine, no drugs. Everyone's like, hey, can I meditate while high? I mean, you can. Some people find it useful, but you're never going to attain samadhi if you meditate while high. Because the neurochemistry that is required to attain those states of consciousness has to be incredibly precise. People won't even eat potatoes or onions or garlic because it alters the body in such a small percentage. But I don't know if this kind of makes sense. If we look at something like the top end of the bell curve, a very, very minute change, what separates someone who is the 99th percentile from the 99.9th percentile? It's a very small thing. Right? And someone's mentioning FODMAP. Yeah, so we understand this, right? So there's FODMAP, which is a particular kind of diet that alters our brain chemistry in a particular way where it can help with things like depression and anxiety. One of the attendings that I had at McLean Hospital is a guy named Chris Palmer, who's a big fan of the ketogenic diet, has written a bunch of books about it, how it improves things like epilepsy and mental health. So all of this extreme meditation stuff is about attaining these higher states of consciousness. And that's all dangerous, right? Because this is the stuff where we're messing around with the metabolism of life and death. Breathing once per minute is lethal. Once every 6 minutes can be lethal. We call that asphyxiation. Right? Breathing 240 breaths a minute is some crazy amount of hyperventilation that's very dangerous. And what we see from the studies on the dangers of meditation is the more hardcore you go, the more dangerous it is, which is why this stuff is not taught publicly. Right? So I don't know if y'all noticed, but I've stopped teaching a lot of meditation. And that's because I taught the basic stuff. The rest of the stuff is not super safe to teach. Right? So there's a lot. I've taught 10% of what I know, but the rest of the 90% isn't safe to teach. Because you start playing with fire. We start creating that neuroplasticity. And unless you integrate the neuroplasticity in the right way, it's very dangerous. Now, speaking of not safe to teach, this is where we get to the other dark side of meditation. Gurus. Now, there's a lot to understand here. No more new ones. We'll get back to it. I'm working on it. I have to think about what to teach because I can't just keep going. So I'm working on it, okay? So why do we need gurus? So since this stuff, so if we think about the mastery in the realm of meditation, mastery in the realm of meditation is not mental. It can, because now we're dealing on the realm of experience, right? That's what a guru does. So these old yogis and stuff from ancient India were called rishis. Rishi comes from the root word see. They're called seers. So they developed certain practices and were able to see things. That's a subjective experience. Now, the problem is that all of the stuff that these gurus do, the good ones, the real ones, they're in the realm of experience, in the realm of consciousness. And that's not a material thing, right? So we can't measure consciousness. We can't detect consciousness. We cannot detect subjective experience. There's no instrument that can measure love. How do we know that the amygdala is where fear and anxiety come from? Because we ask people, hey, when this part of your brain is lighting up, what are you subjectively feeling? So all of our understanding of neuroscience is rooted in subjective human experience. But neuroscience can't touch it yet. This is why we don't know what animals experience, right? Do animals experience anxiety the same way we do? We don't know. Do they have activation of their amygdalas? Absolutely. But does a cat experience anxiety the same way that we do? We don't know. Why not? Because we can't ask them about their subjective experience. So a guru is someone who is an expert in that path of consciousness, of what happens when you walk beyond the door. And this creates all kinds of problems. Because the first thing is that there's no way that we can verify the legitimacy of a guru, because there's no external test. Right? We can't measure it. We can't tell if this person is a scam artist or if there's no way to measure the quality of someone else's experience. Now, as you meditate, and as you, I know this stuff sounds super shady, right? And this is not scientific. It doesn't mean that it isn't real. So this is also something that we need to understand. The root of science is human observation. The reality and the confirmation comes next. So we're just at the stage in scientific development where 10 years ago, 15 years ago, we didn't even think about the differences in different kinds of meditation. Now we know, okay, there are different kinds. It's not all the same. And these things have differential effects on the brain. We're just getting there. We'll get there. I think science will get there because science always gets there. It's just we don't have the instrumentation to measure thought or consciousness yet. That's all. So someone will make a breakthrough at some point. So now the problem is that you have a guru, and you as a student don't know who's legit and who isn't. And then we have some of these other doctrines like faith. And the problem with a lot of meditation is that it is ripe for abuse. So let's talk about this for a second. Okay? So let's just talk about faith. So here's why faith is critical for meditation practice. So if we're not operating on faith, what are we operating on? We're operating on logic, right? Analysis, data, reality. And you may say, but Dr. K, that sounds good. And sure, as a medical doctor, as a scientist, as someone who loves my iPad, I'm a huge fan of logic and analysis and stuff like that. The problem, though, is that, see, if you have an expectation that something will work, why should I meditate? Convince me to meditate. Give me the logical answer to meditate. So if I tell you, okay, if you meditate, you'll have this kind of spiritual experience, you'll get this kind of benefit, this will happen, this will happen, this will happen. But the problem is it's not a precise science yet, because your mileage may vary. It may take you a year, it may take you 2 years, it may take you 10 years, it may take you 10 days. And if we have to convince the mind, then things become really difficult. Because if you do not get what the mind was promised, it says no. And so the perseverance won't be there. The other problem in meditation is that if you tell the mind, here's the real problem, is if you tell the mind this is why you should meditate, that creates an expectancy. And an expectancy prevents samadhi. You can't move beyond mind if the mind is looking for something. Right? If you're looking to attain a meditative state, you will never attain a meditative state. This is why the second meditative state is the hardest to experience. The easiest, not the easiest, but the first one is oftentimes easy because people aren't expecting it. So this is why gurus, and it's hard to describe, but faith is incredibly important because the path of meditation will test you in so many ways. And unless you have that stupid perseverance, you won't make it. Now, the challenge is that if we say, in order to meditate, you need to have total faith, what does that open the door to? It opens the door to total abuse. Power corrupts. Absolute power corrupts absolutely. So this is the core conundrum. Opens up all kinds of dark sides of meditation. We talked about all these gurus and stuff that are problematic. That's why please don't make a guru of me. I don't have the capability. I'm not that good. Just I'm one of y'all, and I'm a doctor, sure, I'm a streamer or whatever, but like I'm not a guru. Okay? I don't want that shit. Just don't want it. Can't do it. Don't want it. Okay? I'm not capable. So, but this is the problem, is that the path requires faith, the path requires perseverance, the path requires sometimes stupid amounts of money. And then, but like, that also opens it up to abuse. So I think that there's a bunch of false gurus out there. Right? Because we don't know how to judge them. Now, how do you tell the difference between a real guru and a false guru? The way you tell the difference is not through any external thing. And this was a part of my journey too. Where what I would do is make a judgment based on a price tag. I'd be like, if this person is charging a lot of money, I think they're a scam artist. Now I've become a little bit more open-minded about that. Jury's still out. But I realized, you know what I need to do? I need to be scientific about it and test my hypothesis, right? Why would I think about it? It's not scientific at all to judge someone without studying it. Go to someone who charges a lot, go to someone who charges a little, and see if there's a difference. And then there's also a challenge because there's a variability in people who charge a lot and variability in people who charge a little. So it is a great question. How do you level up your perception? So I think it's through practice. So when you practice a lot, okay, now we're not saying that you should go to intensive meditation retreats and stuff because we spent the first hour talking about how that's dangerous. But what I would encourage you all to do is when you practice, continue to practice. And as you practice, just pay attention. That's it. So we've given you all some practices. So I'll give you all one right now. So what I want you all to do is close your eyes and breathe in and out through your nose. And what I want you all to do is pay attention to the temperature of the breath and localize it. So this is going to take practice. I'll give you all the steps now. Some of y'all who've been practicing may be able to do it, but breathe in. Notice the location where you feel the temperature. Okay, now we've done this before. You guys may think you know what's coming next. Now what I want y'all to do is breathe out and pay attention to the temperature of the breath as you breathe out. And now what I want y'all to do is notice the location where you feel the temperature of the breath. That's what I want you to pay attention to. The location of the exhalation, which can be found by, first of all, paying attention to the temperature. Right? So close your eyes. Okay, so there's not a right answer or a wrong answer. Now what I want you all to do is see how far out the breath goes. How far out does it go? Through the nose. Okay, so this is where, depending on what your awareness is, so just to give you all a sense of like how long this stuff takes. So it's my belief now that meditation progress happens almost like pregnancy. So when I look at the people that I've taught meditation to, and when I think about my own practice, what I find is that like they're basically 9-month segments. And I would say that for me, like the first 7 years of me meditating was basically broken up into like 9-month segments. And so what we're talking about here is like, if you do a practice and you meditate diligently for a period of about 9 months, I think that's how long it'll take to level up. I don't know why this is. I haven't quite figured it out, but this is just an observation that I have. Right? So some people are noticing the air in different places. Fair enough. Keep doing the practice. Some of y'all, I think very few will, and I'm not trying to be like mysterious or anything. It's just, I'm looking at the answers and it's what I expected. But as you do the practice for a period of 9 months, your answer will change 100%. Now, the really tricky thing is that you may be amazed at how much your answer is restricted by your mind. And the more of a no mind state you enter, the more rapidly your answer will change. Right? And so if you guys look at chat, you'll see there's different kinds of answers. And I'm not going to say what's right. It's just do the practice. So someone's saying, but will the answer change because our power of visualization gets better? No. power of visualization, we're not touching that with a 10-foot pole. We don't want to visualize something. We want to observe, right? Visualize is to create something. Observe is to see what's already there. What we actually want to do is unvisualize. We want to remove our perception. And so what y'all need to do if you really want to do this practice successfully is really experience it without looking for an answer. And I swear, I'm not trying to be like confusing and like, oh, like I'm guru. No, it's like literally how this stuff works. Because if I tell you what to look for, that'll create an expectation. If it creates an expectation, you won't have as much of an observation. And if I tell you what to look for, so if I like imagine for a moment that you're like trying to find, I don't know, like a hidden Easter egg. And if I tell you where the Easter egg is, you can go and find it. But your capacity to find Easter eggs gets diminished. So this is a big problem today with like a lot of what I see about teaching meditation is that people are very, very, very easy to give answers. Everyone wants to give answers. Everyone wants to offer promises and this will happen and this will happen and this will happen and this will happen. Because we realize that the world doesn't like faith. We all want to know what we're going to get ahead of time. You know, when you're interested in a show, I don't know if you all do this. I do this now where I go to a bookstore. If I'm interested in a book, I check the reviews before I buy it. Before you try a restaurant, check the reviews. Before you see a psychiatrist, check the reviews. We all want the answers ahead of time. What am I going to get? Give me a promise. The mind is getting very difficult at faith. And so this becomes a huge problem when the goal is refining your capacity of observation. If I tell you what the answer is, your capacity to observe won't go up at all. Okay? So, speaking of the dark side of meditation, I mean, this is the problem, is that I think there's a lot of good, powerful techniques that should be taught and can be taught by gurus. How do you find one? How can you tell the difference? Should you be careful? Absolutely, because we have lots of historic evidence about abuses of power. And this is a big problem with meditation that we see a lot, which is that a lot of this meditative stuff gets hijacked by things like the ego. Right? And this is what's so tricky, is that a lot of these side effects of meditation need to be worked through in the right way. This is kind of the other dark side of meditation, is that if we look at some of the side effects, some of those are like the goals of meditation, being less interested in other people. Like, I don't care about other people's stuff anymore. I don't care about celebrities anymore. Is that it will change the person that you are. And sometimes people don't like that because you get freed from some of your patterns and it can be very scary. Right? There's this concept of the dark night of the soul, which I think was a poem that was written by a priest. And they talk about how, you know, when we look at like growth, and this person was talking about faith in God, but we have some experience of God, and then we have a lot of darkness that comes afterward. We have a feeling of distance. We stop becoming the person that we are in order to become, it's a step to become the person that we are growing into. And when we meditate, a lot of negativity can come up. That's part of the process. It's cleaning it out, right? So we talked about the psychological defense mechanisms protecting us. That's dangerous if you have PTSD. But every human on the planet has some kind of suppressed psychological stuff. And so cleaning that stuff out can see an increase in negative emotion. So everyone talks about meditation like it's a good thing, but the subjective experience of it can be deeply painful at times. We'll also talk about things like ego death, where you lose sight of who you are. And when you're in that dark night of the soul and there's a cult around you, they will turn you into something unhealthy. Right? So that's the real danger. But even if we look at, y'all should check out this video on quarter life crisis, which is super fascinating that we did. But one of the things that we know is Reinventing yourself requires distancing yourself from the old you. And so that's dangerous. It's like dangerous, dude. Meditation is all about playing with these parts of yourself, right? Deconstructing yourself. And it can absolutely be dangerous and should be done with proper guidance. And the real challenge is that proper guidance is hard to find because the people who supposedly can properly guide you are the ones who are the most likely to abuse. And so how do you find a guru? I say you go to, first of all, practice yourself. And the second thing is go to places where gurus are to be found. Right? So go to ashrams, go to monasteries, go to solid spiritual institutions, go to places like Kripalu. It's like secular. It's good. You don't have to join a cult. Right? And that's the other thing that I would say is like, don't go too deep into one thing. Or at least not until you're ready. There are times where it's not that you're going deep into one thing, it's that you realize this is the only thing that you need, which is kind of going deep. But you know, I'd be like really careful about people, this community included, where like, you know, don't go super deep into this stuff. Like, we're here to help you and stuff like that, but you should maintain your own independence and don't over-identify with this community. And like, you know, like you should have, like, the whole goal of this community is to help y'all build an independent life. Right? So we're here to help. Like, it's cool. Like, you know, there's a lot of love here. Like, I acknowledge that. I think it's wonderful. And also, y'all should have a life outside of this. I want this to be 5 to 10% of what y'all do, not 95% of what y'all do. And we see this as well. People in the community will be, I've been watching all of Dr. K's videos. I don't know what to do now. It's like, go do other stuff. Right? No, and that's where, like, to be honest, y'all, we have to be very cognizant of this. This is what I'm grateful for my training as a psychiatrist. You can't pretend something isn't a thing. You have to acknowledge it. We have to be cautious of this. Right? We have to be cautious of elevation of Dr. K into a guru. It's only going to lead to problems because I'm not enlightened. And if you guys idealize me, all I'm going to do is disappoint you. Please no. And honestly, I'm just some guy on the internet. You should not treat me as any more or less than that. And the cool thing is everyone's like, oh, Dr. K has changed my life. Like, think about that critically for a moment. Okay. And this isn't me like uncomfortable with praise. Like, who is it that does the changing of your life? Like, literally, I'm not trying to be some falsely humble guru or anything. Like, just think about it, right? I'm not the one who's waking up every day. I'm not the one who's cleaning your kitchen. I'm not the one who's setting boundaries with your family. I'm not the one who's, you know, being more proactive with the people that you love. I'm not the one who's lifting weights in the gym. I'm not the one who's meditating in your house. I'm not doing that. And so when I say it's not me, it's not like some, like, oh, like, I mean, like, literally, like, if we look at who's doing the actions in your life, it's you. I'm not living your life. Am I helping you along the way? Sure. I'll take that. Take the gratitude with that. Do I help my patients? Absolutely. Do I help my coaching clients? Absolutely. I'm not saying I don't help. But be careful because y'all are doing yourselves a disservice. When you look, see, this is the problem. Is that when you look at the change in your life, you're still operating from this idea that I can't change. And so then what you do is you give me the credit. You're like, I'm going to go put the credit on his shoulders. It's like, cool. But literally, who's doing the work? And if you stop and think about it, why is it that it's so hard for you to accept that you did the work? That's what you need to be asking yourself. Right? Then help you help yourself? I am. I'm doing what I can do. The question is, what can you do? Okay, let's take a couple of questions. So, Dr. K, what do you think is the answer to the ship of Theseus? So I think this has been solved by yogis a couple thousand years ago, right? So the one thing that never changes, so the ship of Theseus is like, okay, there's a ship, right? If we replace the mast, is it still the ship of Theseus? Sure. We replace the sails, then we replace some of the hull, then we replace the ropes, then we replace this. At some point, you can turn over the whole ship. Is it still the same ship? And this is where I think the true self, there is a solution to the ship of Theseus, which is absolute, which is recognition of the true self, elimination of the ego, moving beyond the ahamkar, right? So your thoughts change, your emotions change, your body changes, your hair changes. You get sick, you get healthy, your voice changes, your identity changes, your net worth changes, your self-respect changes, your self-esteem changes. Everything changes. What's the one thing that never changes? You are always the one experiencing it. That's the one unchangeable thing. You can never experience me and I can never experience you. That is the solution to the ship of Theseus. You're right that everything else changes. Are koan a scientific way of proving someone's enlightenment? Absolutely not. In fact, they're the opposite. So a koan can bring you to enlightenment, but it's not a test. Because a koan doesn't have a right answer. Because a koan, by definition, does not have an answer. That's the whole point of it. And once you understand, see, a koan is beautiful. It's awesome. Because a koan is an instrument to move beyond mind. The whole point of a koan is that it is not logically graspable. So the only way to understand a koan is to move beyond logic. So are any thoughts on Krishnamurti? I think Krishnamurti is good, right? So I think this is where find the teachers that resonate with you. What's the right way to meditate? Whichever way works. So this is where we start with things like, and we have a whole playlist on our YouTube channel. You know, Nadi Shuddhi Pranayam is a great way to start. Alternate nostril breathing. Great way to start. Oh, how to get out of freeze mode in CPTSD. That's a long answer. So I would say we did a deep dive into CPTSD, which I think is still sitting on YouTube, and we got really positive feedback about. There's also the Guide to Trauma, which goes into a lot of that stuff. But I think, and then Bessel van der Kolk's Body Keeps the Score is an excellent resource. So I'd say those are the three places to find the answers. But I'll answer briefly now. So I think you got to understand that freeze mode is a reaction. So if you want to stop freezing, there's some amount of physiologic retraining that you can do. So this is why we have things like exposure and response prevention, exposure therapy for phobias, really understanding what your triggers are, and then strengthening some aspects of like neurochemistry or neurology. So as your emotion regulation improves, as you feel more safe, right, which can be done by working through your triggers. So I feel triggered by this, but conscious decoupling of that trigger. Oh, even though I feel unsafe, I am actually safe. Being able to do that will short circuit the freeze response. And then some amount of like emotional regulation techniques, even like physiologic stuff like yoga, mind and body practices, they can all help with that. But it's like, there's not like a thing. It's rewiring all the stuff that has been miswired with trauma. Okay, so someone's asking, who is the person who experiences? That's the question. Right? That's the question you should answer. A koan is like a meditative riddle. So pretty popular ones are, what is the sound of one hand clapping? Right? It's like, yeah. So I see a lot of people are asking particular questions about specific people who are meditation teachers. I'm not going to comment on them. We don't talk about people. We talk to people. So I know I commented on Krishnamurti, but I can't talk to the dude. Right. So you can go like this, right? Aha. So it's a good example of this is kind of the pitfall of the one hand clapping. Because it's kind of like the logical mind will be like, haha, I can defeat it, but that defeats the purpose. You're kind of falling into a trap yourself and you think you've solved it and you haven't. Yeah, do I believe in life between life or past lives? Basically, yeah. Can you explain Chittakash colors plus white lines during Kundalini meditation? Sort of, but I think I won't. What yoga books can you help to read to help with meditation? So I don't know that yoga books are the best things to read for meditation, which I know sounds kind of weird. I mean, you can read Patanjali's Yoga Sutras. I think that's a great book to read, but he doesn't teach much about meditation. What's a good book on meditation? I think the Bihar School of Yoga has good books on meditation. And pick the one that, there are a lot of copy pasta involved, so pick the one that works for you, that you like. What's the law of one? Meditation for ASD people. So I saw that there was a question about meditating with music. So with autism spectrum, I think autism spectrum disorder is so patchy. Not everyone has the same degree of variation, right? So some people will have like ARFID-like symptoms where they're very sensitive to certain physical textures in the mouth. Other people will have, super concrete thinking. Some people will have difficulty with eye contact. Some people will have difficulty with empathy. So it's pretty patchwork. One thing that I will say about neurodivergence and music is that if you have ADHD, oftentimes you need some kind of sensory stimulus to calm your mind down. So with people with ADHD, I'll recommend sometimes keeping your eyes half open when you meditate, or doing something like listening to music or walking. There's something about a baseline level of stimulus that actually makes it easy for ADHD people to concentrate. So in group therapy, oftentimes what we'll do when we're discussing particular things is we find that it's useful to have people knit. So I worked on one unit, a borderline personality disorder and trauma unit, where anytime we would do group psychotherapy, we would give everyone the option to knit. And so we know there's something about repetitive activities or sensory stimuli that can actually help you focus the mind. So I think that's where you got to really look at the way that your mind works. Is Kundalini meditation dangerous? Yeah, it is. What practice would you recommend for people with irritable bowel syndrome? So I'd say talk to your doctor about it. And usually there are people now, the field is good enough to where there are functional medicine specialists and IBS specialists where you can usually find these people. It was very different 20 years ago. But I think that there's a lot of mind-body practices are very good for things like IBS. I think there's studies that show that yoga and Tai Chi can be helpful. So I'd recommend those kinds of things. So with IBS, a big part of it is reshaping your relationship with your body. So the problem with IBS is that the body becomes an anxiety-producing thing. So when you sense things in the body, that's dangerous. So even gas in the bowels that can be completely benign gets interpreted as dangerous. We had a lecture on psychosomatic medicine, which y'all should definitely check out if you're interested. Can meditation help migraine? I hope so, but I haven't looked at the research into that. And I haven't treated migraine very much with meditation. Oh, gut health is huge for meditation. So the question is, what is the impact of gut health on meditation? So let's understand something. If we go back to these studies, right, we see that, right, so first thing is like we look at this. Intense meditation correlates with all these melatonin, acetylcholine, glutamate, NAG, DMT, noradrenaline, cortisol, all this stuff matters for meditation. Now the question becomes, where do we get that stuff? A lot of it comes from the gut. Right? So our helpful gut bacteria will do things like create neurotransmitter precursors for us. And so there are some diets, so there's some gut bacteria that are associated with anxiety, some gut bacteria that are associated with depression, and stool transplants and altering your gut bacteria also leads to improvements in anxiety and improvements in depression. So gut health is huge for meditation, very important. That's also why if you look at ashrams and monasteries, they all have very, very specific diets. And I think it's to cultivate the right kind of gut bacteria that you need to attain the higher states in meditation. Are there ever new babies? Or are they all reincarnating? Personally prefer either? I don't know. It's a great question. Because the number of humans on the planet is increasing. Great question. Are you excited for the self-esteem lecture? Absolutely. It's going to be great. So self-esteem lecture is over on the membership side, which, by the way, FYI, we started memberships about a year ago. We didn't know if it was going to last, but it's going great. Just a quick heads up. So someone asked a question about memberships. So a couple of things. One is a year ago, we launched memberships. And the idea behind memberships is that it's a chance for us to go a little bit deeper. So the community votes on which lectures I do. So I'll prepare lectures based on what y'all want to hear about. It's been a lot of work, but it's been fantastic. So I want to say we have, I think we do solid 4 lectures a month, right? For close to a year. So we probably have like 50 lectures plus Q&A and stuff, like somewhere around 50. We actually have it on Circles now. So it's all over on the YouTube side or on Circles. And the cool thing about Circles is because as we kept doing it and it didn't die out and more people joined. So there were a couple of problems we ran into. First is that some regions are actually blocked by YouTube. So we have people in this community from 121 countries around the world at a minimum that we have data on. But some of those countries, people can't access stuff on YouTube. So on Circles, y'all can access it. We also needed to organize the VOD library. So there's you can find what you're looking for because now there's 50 some odd videos on there. And YouTube doesn't let us do that. So there's more of a step-by-step stuff. And there's also a centralized community space. So we asked people, and we even talked to YouTube about what features we were looking for, right? But it takes them time to build it, and Circles has a lot of this stuff built in. So y'all can take your pick. But Circles also has spaces for discussion, events. You can work on quests together. There's a lot of cool stuff in there. And then we got some feedback that Discord was kind of too confusing because it was stitched together across different places. It's some stuff is on Discord and some stuff is on the YouTube community. So everything is kind of in a one-stop shop on Circles. But if y'all like the YouTube experience, y'all are welcome to stay there. Hello? Okay, I was just informed that it is not Circles, it is Circle. So it is on Circle. So on there, y'all, so don't confuse the two. I guess they're very different. So there are topic primers, courses, groups for skill and community building, and stuff like that we're hoping to build out on that platform too. Okay. Well, how am I feeling? I'm feeling like my voice is done for the day, y'all. Stool transplant. Yeah, OCD meditation. It's a good question. I haven't treated a whole lot of OCD from an integrative perspective. I think we got to try to find people who are a little bit better at that than I am. But I'll definitely start working on it. But yeah, thank you all very much for coming. I hope this was helpful. And let's take a break. And I'll see y'all, I think, on Friday. So thank you guys, everybody, for the birthday wishes. If y'all, want more in-depth stuff, people do say that, a lot of our content on the membership side is a lot more, it's deeper on the spiritual side, some of it. And I think the self-esteem lecture is a really great example of something that we talked about ego. We talked about identity. And so then I was thinking, like, self-esteem is redundant, right? We've already spent a couple hours talking about ego and identity. But I actually was like, okay, if you guys want a lecture, let me see what I can find. And it actually turned out great. So ego, identity, and self-esteem are actually very different. And so I'm super excited about the self-esteem lecture because I think it's going to be awesome. And I found a lot of cool stuff and it makes sense. So I think it's sometimes also like, talking about it once doesn't land with everyone, but looking at what's the relationship between ego, identity, and self-esteem. And I think we're also seeing that when we approach it from 2 or 3 different angles, like people are like really stitching it together better. And I'm seeing a really, really heartening amount of like understanding. So, yeah, that's how I feel about the self-esteem lecture. Thanks for asking. And we'll see y'all on Friday, y'all. Take care, everybody. People are asking about karma. So we talk about a lot of that stuff. I think we did a deep dive into karma on the membership side. So if y'all are interested in that, check it out. Okay? Take care, everybody.